People who had COVID reported a wide range of post-infection symptoms to their primary care physicians. And according to a new study, well, some might have been a little surprising. Beyond the widely reported issues like loss of smell and shortness of breath, long COVID symptoms now also include things like hair loss, sneezing, even sexual dysfunction. Fox Medical Team's Dr. Mike joins us now with more on that. And then we have a little bit of a surprise for the second segment. Mike, good to see you this morning. Good morning.
Always a pleasure, Steve.
What do we find out when it comes to more of these long COVID symptoms? It seems like those of you in your field are starting to hear more and more of a variety of symptoms.
Well, Steve, we learn more and more about COVID-19 every single day. And we're learning more about long COVID. About 5% of people seem to experience some form of long COVID. And some of these include, frighteningly, hair loss and sexual dysfunction. Now, before we start panicking, number one, hair loss, known as telogen effluvium, has been well documented, and it tends to go away over time. And that's due to the stress of the viral infection. And I've had many patients in my practice kind of freak out, Steve, and we just work through it, make sure there's no other cause, and we get through it, and their hair comes back. Sexual dysfunction, again, over time, tends to come back. You just need to be patient. And most importantly, Steve, make sure you're vaccinated. Get those boosters to prevent serious COVID-19 infection.
Yeah, still learning about some of these long-term effects. Well, maybe the good news, you talk about the hair loss and a lot of that having to deal with stress. High blood pressure also comes from stress. And this is where we're going with the second topic here. The correlation between high blood pressure and potentially treating it with a tattoo. I need to hear the details here.
Steve, I am stoked about this research. Let me tell you why. High blood pressure, also known as the silent killer, if you will, is one of the major things that I deal with every single day in my practice. It's a big-time killer of Americans. Now, getting accurate blood pressure readings is tough. Some people, they come into the doctor's office, the healthcare provider's office, and their blood pressure goes up just by looking at me. But what this does is it's a tattoo, an electronic tattoo that you put on the skin, and you can monitor continuously your blood pressure, get accurate readings, even get readings while you're sleeping. Way to go, Steve.
This is fascinating.
That is the ticket.
Is it like, this is kind of like a human barcode scanner type situation? Is that what we're talking about?
Well, you know, we're ultimately getting to, remember Bones in Star Trek? He was able to lay you on a table, and in 2 seconds he knew everything without doing any needles or anything else. So this is a step forward in tackling a very challenging and very difficult thing, hypertension. We need accurate data, and that's what this provides. It's very exciting.
All I need now is to be able to get that tattoo as a Dr. Mike tattoo, and then I'm good to go. And I'll be happy to monitor that blood pressure forever.
Listen, I hope it comes out soon. It's being researched, should be out soon, and it would be my honor, Steve, to apply that tattoo, because I want you to live to 110.
All right, I'm right there with you.
110, Big Daddy. All right.
Thanks, Dr. Mike. Always good to talk to you. Dr.
Steve.
Mike Spergliano, it's always a pleasure. Thank you, my friend. Love you back. Subtitles, not just for the